All right, many Northeast Ohio hospitals still struggling with the surge.
A flood of COVID-19 patients pushing hospitals to capacity. 336 more COVID-19 patients were hospitalized in the last 24 hours. The concern now is that patient care could suffer. 5 on Your Side investigator Scott Knoll has more from Akron tonight.
To give you an idea of the impact of the COVID-19 surge here at Akron Children's, one administrator tells us the hospital could start treating adult patients, all in an effort to handle the number of sick people needing care. They're the signs of a healthcare system pushed to the edge.
When it comes to occupancy of the hospitals, they're running between 85 and 95 and sometimes 100%. Full.
Dr. John Crow of Akron Children's Hospital chairs a committee set up to deal with hospital surge across 13 Northeast Ohio counties.
We have a lot of resources of hospitals and medical people, but is there a limit? Yes, there is a limit.
And he says we're quickly approaching it. Already, Crow says smaller hospitals have begun sending patients to larger cities like Cleveland for care. Crow says the problem isn't a shortage of beds or equipment, but people, having enough healthy caregivers to take care of the sick.
These nurses, these doctors, these respiratory therapists, you can't just train someone to become one of those in a week. And so that's where the big limit is.
Crow says plans are already underway to have specialty and children's hospitals begin seeing adult patients to handle the surge.
As short as 10 days. Well, the whole state, we could be talking about it in the next 2 weeks.
So what does all of this mean for patients? Crow says sending them away from home could mean they won't get care from the doctors who know them best, and an overrun healthcare system forced to rely on worn-out workers.
We are people too, and everybody taking care of you can make a mistake, can miss some of the subtleties that you're getting sicker, all the things that could mean that your overall outcome could not do as well as if things weren't in such crisis.
The doctor says the one thing you probably won't see are makeshift hospitals set up to care for the surge in patients. He says that's because right now there simply aren't enough healthy caregivers to staff those kinds of facilities. And all of this comes as hospitals are preparing for another surge in patients later this week connected to Thanksgiving gatherings. In Akron, I'm 5 on Your Side investigator Scott Knoll.